Hi guys, good day to everyone on my TikTok page. Happy Wednesday to each and every one of you guys. Today I'm going to be continuing my topic on mental health. Everyone experiences mental health. Mental health can be seen as a continuum, whereas everyone experiences some type of mental health, right? Some aspect of mental health. It can be acute, it can be chronic, or it can be malignant. Okay? When I say everyone experiences mental health, it's because some days you might experience feeling overstressed, overwhelmed with the stresses of life. And then you may feel depressed. Or maybe you might be scared of something. Some type of the environment where you are in. Maybe you probably might be attacked by someone or something, and then your body reached to a stage of fight, flight, and then your body feels to a stage of anxiety. It might be for a short term, it might not be long term, but everyone experiences some type of mental health, whereas it can be up or down. It can be seen as a continuum. As I explained in my other videos, mental health is a syndrome. Mental health can be categorized as a syndrome of characteristics significance to a dysfunction of cognitive, behavioral, and emotional well-being. An individual within their mental health, some form of dysfunction, something have interrupted their mental functioning, something trigger it. It can be biological, chemical, it can be substance abuse. Substance abuse is under the category of mental health. Some people smoke cannabis. We know it as weed. Okay? The plant, some people smoke that. Some people can smoke that and it can make them calm. Some people, on the other hand, may smoke cannabis and it can affect their mental health. Some people might be intoxicated with opioids. Different types of pain medication, oxycodone. Some people might abuse alcohol use, alcoholism. All these substance abuse fit under the category of mental health. It is called substance abuse, right? And these individuals will need immediate help. Okay? Mental health has different and many range. It's a spectrum that has lots of factors, lots of associations, lots of diagnoses, from depression to anxiety to PTSD, post-traumatic stress disorder. People who experience post-traumatic stress disorder, we know veterans experience that. Normal people experience PTSD, where they have a memory of a fear, that's something that they did not want to remember. That fear that they have suppressed in their unconscious part of their mind, and now they have to relive that day all over again whenever that memory comes about in the conscious part of their mind. So some people experience PTSD, right? Some people experience OCD. Okay? Some people experience ADHD, neurodevelopmental disorder. Neurodevelopmental disorder can be onset. It can happen in early childhood. It can be a developmental deficit, produce impairment of the developmental functioning. It can cause limitations in learning and socializing with people. Some children are diagnosed with ADHD at an early age. But all these diagnoses and mental health disorder can be treated. It can be treated with either seeking therapeutic help, by speaking with a clinical psychologist, or there might be needs of medication to help stabilize that dysfunction. And you all have to keep in mind that mental health, when there is a dysfunction in the mind, it can be contributed by many factors. It can be genetic, meaning that a generation before you, he or she were diagnosed with schizophrenia, bipolar depression, with some type of mental health disorder, and it was passed on inherently to you, innate. You're born, and innate in you have developed some type of mental health disorder genetically. Now, mental health can also be affected by your environment, whatever you go through on a daily basis, the things you do, the people you socialize with. Mental health can happen onset. Okay, also mental health can be factors contributing to mental health can also be cultural. Can be cultural as well. Social construct, whatever you believe, the idea within your social, within the environment of your culture, whatever you believe. Sometimes things have been forced upon you, things that you don't want to do. It's just your culture. It's just the way that your culture do things, and sometimes you may not want to be a part of it. And because you are forced to do it cohesively, therefore it can trigger a form of mental health dysfunction, right? So there are many factors that contribute to mental health, but I want everyone to know that you need to remove the stigma that surrounds mental health. You need to understand that lots of people experience mental health. And some people, when they experience some type of psychological disorder or some type of mental health disorder, sometimes they don't know what to do. And they need to know that there is no shame or embarrassment whenever there is a need, where there is a need of intervention, where you feel that you reach in a place where you want to give up. And when people reach to that place, sometimes they give up and they unalive themselves. Okay? So, I will continue to talk about schizophrenia. Schizophrenia is a heterogeneous clinical syndrome. Okay, the reason why I'm talking about certain mental health disorders, because these mental health disorders are more pervasive. They are prevalent. Schizophrenia, depression, anxiety, PTSD, OCD, they are pervasive. They are more prevalent. So that's why I'm talking more about these. The mental health which you know about, which lots of people, the majority of people experience some type of mental health disorder. Okay, so let's go. Schizophrenia is heterogeneous clinical syndrome. Okay, it is a cognitive, behavioral, a dysfunction of the cognitive, behavioral, emotional. There's a dysfunction there. Now, in schizophrenia, there is not one indicative of this disorder. So scientists can't really pinpoint and say what causes. There are different things that can trigger schizophrenia. It can be environmental. It can be genetics. It can be substance abuse. It can be anything that can trigger schizophrenia. Likewise, anything can trigger mental health. Some people smoke cannabis. Some people, it makes them feel calm, relaxed. Another person, on the other hand, may smoke cannabis, and it might cause them to experience some type of schizophrenic, or maybe experience some type of bipolar depression or hallucinations. Okay? Certain substance abuse, drugs, alcohol, and opioids, they can trigger onset mental health disorders. Okay? I also would like to talk about narcissistic personality disorder. A lot of people know about narcissistic, right? They know about that. But that is also a mental health disorder as well. It is also a mental health disorder. It is a pattern of grandioses. Whereas people who are narcissistic, what they do, they lack empathy. They are grandiosity of self-importance, all about themselves. They are envious. They envy people around them. And they think they're always right. People who have narcissistic traits. Narcissism is under mental health as well. And that word, a lot of people throw that word around, and some of them probably not aware that it is a mental health disorder. It is called narcissistic personality disorder. Okay? So, I will continue with my topic of mental health because it is very much important. Okay? It is very much important, and people need to remove the stigma that surrounds mental health. And I will say and say again, if you feel that there is a need, whereas you feel sad, you feel like you would like to unalive yourself, please seek immediate help. There is institutions there that is willing to help you. You can call the mental health hotline and ask for help. Please don't feel embarrassed or feel shame to reach out for help. And sometimes the help that you may only need might be therapy, whereas you speak with a clinical psychologist. Or maybe you may need to be placed on medication, but the meds and the therapy will help you. I know some people have their Christian beliefs. I know that. I know some people would like to use defense mechanism. Some people use coping mechanism. But my advice to you all is this. The statistics as of today, there are a lot of people who unalive themselves on a daily basis. And sometimes there could have been some form of intervention by a family member or by a friend. But what some people do, they turn a blind eye and they ignore that friend and they ignore that family member. And what I'm saying to you is this, that no one is immune from mental health disorders. No one. Because you might be going through a particular situation in your life, and that can cause a dysfunction in your brain, and that can trigger an onset mental health disorder. As we go through life and we experience the stresses of life, it can affect us physically and emotionally. And that's why I'm saying let's remove the stigma that surrounds mental health. And if there is a need, whereas you feel like you need help, please reach out to some institute. Reach out. They're called the hotline. If you're in Trinidad and Tobago, there is help out there. If you are in the US, there is help. There is always help. It don't hurt to sit down with someone. It don't hurt to explain how you feel. The thing that is bothering you, the thing that has been attached to you, the thing that you have not dealt with, the situation, that undesirable situation that you put away there in the unconscious part of your mind, and you suppress it there, and you said, you know what, I don't want to think about it, because when I think about it, it's going to make me feel hurt. the thing or the situation that hurt you, the experience, whatever the abuse you encounter a few years ago, and you place it there in the unconscious part of your mind, and you have not dealt with it, you have not experienced healing for it. You need to deal with it, you need to face it, and you need to recognize that it is there, and you need to seek help for that hurt, for that issue. Deal with it. Talk to someone. Cry if you want to cry. The more you cry, you're going to feel restored. Okay? And if you need help, ask for help. Okay, guys? So thank you, ladies and gents, for listening. If there is someone in your family, whether it's your family member or your friend, that is going through some type of mental health disorder, please make intervention and seek help for that individual. If you yourself is experiencing some type of mental health disorder, remember, mental health is not one diagnosis. It is a spectrum. It is a broad spectrum. It can be alcoholism, where you experience drinking regularly on a daily basis, drinking to the extent of abusing alcohol. It can be opioids use, whereas you keep taking pain medication to subdue that pain that you're feeling, whether it's a physical pain or emotional pain. It can be perpetuating narcissistic traits, narcissistic personality disorder. Just remember that mental health is not only schizophrenia or bipolar depression or mania. Mental health is also seen as substance abuse, narcissistic personality disorder, eating disorder, and different disorders. There are multiples, different factors of disorders that are under mental health. And whatever you are going through, just remember that there is help. If you don't feel like talking to a family member, you don't feel like talking to your friend, go on the phone and call the hotline, the mental health. There should be an institute that will help you. There should be an organization that is there in your community, whether you are living in the US or you're living here in the California or in Trinidad and Tobago, which part of the world you are, there is organizations and institutes that are there to help you. And just remember that you don't need to feel embarrassed to say that you need help. Just ask for help and help will be granted. Okay, so you all have a beautiful Wednesday. Take care of yourself. And just remember, let's remove the stigma that surrounds mental health. And just remember that everyone experiences mental health at some time, because it's a continuum, up and down. Some days you may feel happy, some days you may feel down. We are just humans. We are humans, and we have feelings, and our emotions can fluctuate. Something can happen and we can feel excited, whereas the body is excited, or the body can go through a stage of fear. You went to the doctor and you got a bad report. You can go through some part of anxiety. The doctor told you that you are diagnosed with a particular disease, and it stresses you. If you go through a stage of anxiety, that is mental health. So just remember, remove the stigma that surrounds mental health. We all need help. We are not perfect. So you all have a beautiful day. Bye.